you're middle class, if you're 40% of poverty above, what Trump's doing is he's pricing you out of the market. And all of us, except for people who are middle class and buy insurance on our own, the government helps us buy our health care because it costs too damn much. We charge each other too much for health care, and so we've decided that if we're veterans, or we're in Medicaid, or in Medicare, or if we're employed, we get a nice tax exclusion, or if we're under 400% of poverty now, we get a break. But if we're over 400% of poverty level, where that's the one population that isn't protected, they actually have to pay what is actual healthcare cost plus 15% markup, and that's too damn expensive. And Trump has made the decision, I believe, unless he reverses course, to say we are going to make that population pay the price in order to make the law so bad that somebody has to do something. And so I think you do end up with kind of a very politically important, isolated group of people that are increasingly angry and upset and demanding something be done over the law. So I'm not quite as optimistic as saying that we are in find some limp along equilibrium. I think we will end up with a population there that is quite challenging.
Look, the big concern is affordability by everyone, whether you've got private insurance or whether you've got Medicare or whether you're being priced out of the market. And it seems to me that's a place where there is some very solid left-right overlap where you could convince the middle class we can do something about it. You've got a president who really likes to regulate drug prices. He doesn't know how, but he really wants to do it. And I think the vast majority of people in the country would love to see that. You've got some other big pricing issues that I think there are some good levers that pretty reliably will bring down some of those prices, and he can point to them. And it befuddles me that I think this is a has broad appeal, bipartisan, big in the population, and it befuddles me that they haven't embraced it and walk away from trying to solve the exchange Medicaid expansion problem, because that's a loser for the Republican Party. And it seems clear as day to me that you're not going to win that. No matter what you do, you pass repeal and replace, you don't pass repeal and replace, you're screwed if you're on the Republican side, whereas the affordability issue just has so much broader appeal and is something we can actually do something about. So I mean, that's the thing that going forward just confuses me, because it seems to me the path is clear. Now maybe, Mark, you can see landmines there that I'm not seeing.
Well, I guess the main one is there's a substantial coterie of ideologues in the Republican Party. Now, maybe the president doesn't pay any attention to them, but eventually they have to vote for things, who, as soon as you say price fixing, they'll go ballistic. And I have to say, as an economist, sometimes for good reasons. Depends. If you fix the prices of things that I buy, that's fine with me, but I don't want to.
Not the things you sell. Not the things you sell.
Not the things I sell. With the durable medical equipment, that Medicare price fixing was terrible, and a free market actually saved us
money. Yeah, so, and to some extent as well with the Medicare Part D.
Yeah.
If we had 100 academics and economists in the Senate, I would completely agree with you. Unfortunately, we have 100 politicians.
No, I know, they're lawyers and
so there's a lot of false ideologies out there. There's a false federalism notion out there. There's a false free market notion out there. And look, to be blunt about it, the Republican Party spent 7 years with the following thought about health policy that could be written on a matchstick: repeal Obamacare. But there is a potential movement towards a federalism kind of approach or model. But the real issue with drug costs, and I think we all have to acknowledge that the real issue with drug costs is nothing to do with ideology. I think ideology is a nice way to say it, but the reality is we have. It costs $8 or $9 million now to run a competitive race in a purple district. It costs at least that to run a Senate race. Nobody can raise that locally. Everybody needs that money to come from party leadership. Party leadership has a couple of important places where it gets money. Pharma has a $485 million lobbying budget. That's the simplest path that I see.